Welcome everyone, my name is Sarah Uribe and today I'll be presenting with Eric DiDomenico on recent findings from Dr. Keck's lab. In this presentation, we will be focusing on assessing the synergistic effects of morphine and MP-III-024 co-administration.
Opiates are drugs derived from components of opium, specifically seed pods from the poppy plant. And opioids are a broader class of medication that includes semi-synthetic, which are derived in the lab from opium. This includes oxycodone, or fully synthetic compounds such as fentanyl. These compounds activate one of four types of opioid receptors, mu, delta, kappa, or FQ peptide receptors. So typical opioid analgesics are extremely effective at reducing pain. However, they do come with several noteworthy side effects, including physical dependence and addiction. And these side effects have led to a major health crisis around the United States deemed the opioid epidemic. Opioid misuse, abuse, and addiction have fueled this, and it is estimated that up to 29% of patients prescribed opioids for pain relief have misused them. And since 1999, almost 1 million people have died from opioid overdoses. So clearly there is a pressing need for the development of new analgesic treatments that are less subject to misuse and abuse. So the question that we are trying to answer is, can we find new medications that can be co-administered with opioids that will selectively enhance analgesia? Doing so would reduce overall opioid exposure, and therefore the risks of opioid-induced side effects would be decreased. On the right is our compound of interest. It's MP-III-024. It's the alpha-2 GABAA and alpha-3 GABAA selective positive allosteric modulator of this study. So morphine initiates pain relief through activation of µ-opioid receptors in the CNS and the PNS. However, pain relief can also be achieved via enhancement of GABAA receptors. MP3 can enhance this signaling in GABAA receptors that contain alpha-2 and alpha-3 subunits that are expressed with µ-opioid receptors along nociceptive signaling pathways. So a previous Keck study has found that morphine co-administered with MP3 produces synergistic anti-nociceptive effects. However, does MP-III-024 potentiate any of morphine's side effects? I will now pass this presentation along to Sarah, who will help answer this question.
I'll begin with explaining food-maintained operant responding. CD1 mice were trained to nose poke to receive a palatable food reward consisting of 50% vanilla and sugar and 50% water on a fixed ratio of 4. Animals were then injected on designated days with either morphine, MP-III-024, or a mixed ratio of both at 3.2, 10, and 32 mg per kg. Our results show that morphine induced disruption in food self-administration at higher doses. The 1 to 0.94 mixed ratio response rates were not significantly reduced, and the 1 to 0.31 and the 1 to 2.8 mixed ratio response rates were significantly reduced. The next experiment was open field hyperlocomotion. Day 0 consisted of chamber acclimation, Day 1 consisted of cumulative vehicle injections, and Day 2 consisted of cumulative drug injections of incremental doses of morphine, MP-III-024, or morphine and MP-III-024 together, and after each injection, they were placed in the open field chamber for 30 minutes. Our results show that morphine increased locomotor activity at higher doses. MP-III-024 has no effect. There was not a significant difference for morphine alone and the 1 to 0.31 and the 1 to 2 point ratios, and lastly, there was a significant difference for morphine alone and the 1 to 0.94 ratio. You can conclude that morphine and MP-III-024 do not have synergistic effects in the disruption of food self-administration, and they do not have synergistic locomotor enhancing effects. Lastly, interactive effects of drug mixes depend on their relative proportions. All in all, this was the first preclinical analysis of dual µ-opioid receptors with alpha-2, alpha-3 GABAA pharmacotherapy strategy, which may increase the therapeutic window between desirable opioid analgesic effects and side effects. Ongoing studies include testing tolerance to see if MP-III-024 affects the development of morphine tolerance, and condition-based preference to see if MP-III-024 affects the abuse liability of morphine, and if MP-III-024 has any abuse liability on its own. Thank you. None of this would have been possible without the help and support from everyone listed on this page.